Why do we avoid uncomfortable conversations in healthcare, even when they could potentially save lives? That's the question we're going to explore today. In the world of healthcare, conversations are the cornerstone of understanding. They bridge the gap between the professional knowledge of the healthcare provider and the personal experiences of the patient. But not all conversations are easy. Some topics are difficult to broach, some questions are hard to ask, and some answers are even harder to hear. These are what we call uncomfortable conversations. Uncomfortable conversations can be about anything from discussing a grim prognosis to asking about personal lifestyle choices. They can be about exploring a patient's fears and concerns or delving into their family's medical history. They can even be about talking openly about mental health, a topic that, unfortunately, still carries a lot of stigma. Why are these conversations so important? Because they help us to see the full picture. They allow us to understand not just the medical facts, but also the human being behind those facts. They enable us to tailor our care to the individual needs and wishes of each patient. Yet these conversations are often avoided. They are seen as too difficult, too painful, too personal. But by avoiding these conversations, we are potentially missing out on vital information. We are perhaps neglecting to provide the best possible care. And we are possibly leaving our patients feeling unheard, misunderstood, and alone. Now, it's true that these conversations can be hard. They can be emotionally charged, and they can bring up issues that are difficult to deal with. But that doesn't mean we should shy away from them. On the contrary, it means we should embrace them. Because it's in these conversations that we can truly connect with our patients, understand their needs, and provide them with the care they deserve. So let's dive into these 6 important questions that healthcare professionals should not shy away from. Question 1. What is your understanding of your prognosis? Diving right into the first question, this isn't just about medical facts. It's about understanding the patient's perspective on their health condition. And yes, it can be a delicate topic, but it's a necessary one. You see, each person has their own perception of their health journey. Some may have a very accurate understanding of their prognosis, while others might be in the dark or in denial. It's crucial to get a sense of where your patient stands. So how do we approach this question sensitively? Well, it's about creating a safe space. Reassure your patient that it's okay to share their thoughts, fears, and misconceptions. By doing so, you can guide them towards a clearer understanding of their situation. And remember, it's not about correcting them. It's about listening, empathizing, and then providing accurate information when they're ready to hear it. Remember, this question can help gauge how much the patient understands about their health condition. Question 2. What are your biggest fears or concerns? Now, this query may seem intrusive, but it's a crucial part of understanding your patient's state of mind. It helps you to navigate their emotional landscape and identify any stressors that can potentially impact their health and recovery. When asking this question, it's important to maintain a gentle and empathetic tone. You're not prying, you're showing that you care. You want to understand their worries, their fears, their concerns, not to magnify them, but to address them effectively. Remember, our aim is to reduce distress, not cause it. This conversation could reveal fears about treatment outcomes, financial burdens, or even worries about their family's future. It could bring to light concerns about their ability to continue working, or fears of losing independence. By addressing these fears and concerns, we can develop a more comprehensive care plan and provide better support. This question can help uncover any emotional or mental health issues that need addressing. Question 3. What are your preferences if your health condition worsens? This question, though uncomfortable, is a crucial part of understanding a patient's wishes and ensuring their autonomy. End-of-life preferences are deeply personal, and as healthcare professionals, it's our role to respect and facilitate these choices. The best way to approach this topic is with sensitivity and empathy. Start by explaining the purpose of the conversation, assuring them that their preferences matter, and that they have the right to make decisions about their care. Ask open-ended questions to allow them to express their thoughts fully. It could be about their preferred place of care, whether they'd want life-prolonging treatments or their thoughts on palliative care. Remember, it's not about predicting the future, but preparing for possibilities. Having this conversation may be difficult, but it can help alleviate some fears and uncertainties. It empowers patients, giving them control over their future care. This question can help ensure that the patient's wishes are respected in critical situations. Question 4. Can we discuss your family's health history? Now, this question might seem a bit intrusive, but it's crucial for a comprehensive understanding of the patient's health. Family health history often provides clues about a patient's predisposition to certain medical conditions and diseases. It can reveal patterns of disorders that might be inherited or run in the family. However, it's important to approach this topic with sensitivity. Start by explaining why you're asking about their family health history. Assure them that this information will be used solely to provide them with the best care possible. Then, gently ask them about any known illnesses or health issues among their immediate and extended family members. Remember, it's not just about digging the past, it's about understanding the bigger picture of their health. This question can provide valuable information about potential genetic risks. Question 5. Can we talk about your lifestyle habits? This question might seem intrusive, but it's a vital part of understanding the overall health picture of a patient. It's not about judgment, it's about gathering the necessary information to provide the best possible care. We all know lifestyle habits play a significant role in our overall health. They can affect everything from our weight to our mental health, and even our susceptibility to certain diseases. This is why it's important to have an open, honest conversation about them. When asking this question, it's crucial to approach it with sensitivity and respect. You might want to frame it as a discussion about how the patient's daily routines and habits might be affecting their health. This could involve talking about diet, exercise, substance use, sleep habits, stress levels, and more. This question can help identify any lifestyle factors that may be impacting the patient's health. Question 6. How are you coping mentally and emotionally? This question is not just important, it's crucial. Physical illness doesn't exist in isolation. It can have profound effects on our mental and emotional well-being. By asking this question, we're acknowledging the interconnectedness of the mind and body. As healthcare professionals, we're not just treating the symptoms or the disease, we're treating the whole person. That's why it's important to approach this question with care and sensitivity. It's not always easy for people to talk about their feelings, especially when they're dealing with illness. The way we ask this question can make a big difference. It's important to create a safe and supportive environment where patients feel comfortable opening up about their mental and emotional struggles. This can help us identify any underlying mental health issues that may need addressing. Remember, caring for the mind is as important as caring for the body. This question can help identify any mental health issues that need addressing. So, these are the 6 uncomfortable but necessary questions to ask your patients and their families. Let's take a moment to reflect on the significance of these questions and their role in patient care. Firstly, discussing prognosis is a vital conversation, though it can be challenging. It's crucial to understand the course and outcome of a disease, ensuring patients and their families are well informed about the situation. This approach helps set realistic expectations and enables patients to make informed decisions about their care. Secondly, expressing fears and concerns. This question encourages patients to articulate their worries, providing a clearer understanding of their emotional state. It's essential for creating a supportive environment and can help to alleviate anxiety and fear. Thirdly, discussing end-of-life preferences is an essential but often overlooked aspect of patient care. It's important to respect and understand a patient's wishes for their end-of-life care, ensuring their dignity, comfort, and personal values are upheld. Fourthly, talking about family history. This question can reveal genetic predispositions to certain diseases, helping healthcare professionals to provide personalized care and potentially prevent the onset of inheritable conditions. Fifthly, asking about lifestyle. This question is a gateway to understanding a patient's daily habits and routines, which can significantly impact their health. It's crucial for crafting a suitable treatment plan and promoting healthier lifestyle changes. And finally, discussing mental health. This question highlights the importance of treating the patient as a whole, not just their physical symptoms. It's key to recognizing and addressing mental health issues, which can significantly influence a patient's overall well-being. These questions, while uncomfortable, are necessary. They foster open communication, promote understanding, and ultimately improve patient outcomes. It's through these tough conversations that we can deliver comprehensive and compassionate care, truly understanding our patients and their unique circumstances. Remember, as healthcare professionals, our job is not only to treat, but also to understand our patients. And sometimes, that means asking the tough questions.